How many types of diabetes are there? If you're like most people, you probably said 2. Type 1 and type 2. Some of you might have said 3. In reality, there are several more, many of them quite rare and poorly characterized. But then there's LADA, latent autoimmune diabetes of adult onset. It's common enough to be clinically important. It's biologically distinct, and it affects a substantial portion of adults who are initially diagnosed with type 2. But despite this, LADA isn't even recognized as its own distinct category, at least not yet. Here's the problem. LADA sits awkwardly between type 1 and type 2. Patients with LADA are adults who initially present with symptoms that look like type 2. Their blood sugar is elevated, they might be overweight, and they don't necessarily need insulin right away. But here's the catch. They also test positive for glutamic decarboxylase autoantibodies, a marker of autoimmune diabetes. That's a type 1 characteristic. So LADA patients have attributes of both types. This makes distinguishing them from type 2 patients challenging. The wrong prognosis can lead to the wrong treatment. LADA patients eventually need insulin, typically within 6 months to a few years of diagnosis. If you misdiagnose them as type 2 and treat them accordingly, you're missing the window for intervention. That means worsening glycemic control, faster loss of beta cell function, and potentially avoidable complications down the line. So, what can we do about it? How can we make diagnosis more accurate and reliable? That's where today's paper comes in. In it, the authors developed a neural ensemble model specifically for this case. On today's episode, we'll walk through the architecture of their pipeline and see how it works. If you're already a member of Journal Club, you just got access to this episode. Log in and watch it anytime. See you there.